Hi there, welcome to Healing After Infant Loss. Today I want to talk to you about termination for medical reasons and talk all about what it is, how this can happen, and just sort of share my experience and some information that people might find helpful and useful. Now, I am not an expert in fertility. I did ask ChatGPT for some sort of prompts and some information to be able to share here. And then at the end of the video, I will share my story of termination for medical reasons where I had an abortion at 6.5 months pregnant. What is TFMR, so termination for medical reasons, and it's the decision to end a pregnancy due to severe medical complications affecting the fetus, the pregnant person, or both. So in my case, it was affecting the fetus and we had the termination, but it can also be because the pregnant person is going to have health issues or struggle with something going on. So it's not the same as an elective abortion, which is chosen for personal reasons unrelated to medical issues. So medical termination is usually discussed around the 20-week mark. So it's usually diagnosed in the second trimester, either after the 12-week scan or the 20-week anomaly scan. So for us, we had the 20-week scan at 22 weeks, and then we had the abortion a month later. So it can also occur earlier if severe abnormalities are detected, or later if an emergency arises. So medical termination can be two different things. It can either be dilation and evacuation, which is a D&E, a surgical procedure typically in the second trimester. I can't speak about that because I don't have any experience in that myself. The second one is induction, where labour is medically induced and the baby is delivered. So you're basically giving birth to your baby. So why do people choose a termination for medical reasons? It's often made under devastating and heartbreaking circumstances. So there's three different sections here. So the first one is fetal medical conditions, and within this there are a couple of different sections as well. So incompatible with life. I have dyslexia. I'm also not a medical professional, so I don't know how to say these words. I'm going to try my best. I might pop it on screen as well. Anencephaly, where the baby is missing major parts of the brain and skull. Triploidy, a severe chromosome disorder. Renal agenesis, which is Potter's syndrome, where the baby lacks kidneys, leading to no amniotic fluid, and severe skeletal dysplasia, bones fail to develop properly. So that's all under the incompatible with life section. There's also the severe disability or suffering. So maybe the baby has congenital heart defects. Some conditions require multiple surgeries and have low survival rates. Hydrops fetalis, severe swelling due to fluid buildup in organs, and brain abnormalities such as holoprosencephaly, severe ventriculomegaly, or neural tube defects. I'm so sorry I don't know how to say these words. I'm trying to do a serious video and I have no idea how to say these. Maybe at some point I need to speak to somebody who's an expert, but I really want to share about this topic because I think it happens all the time and people feel like they're alone, and you're not alone. I have also been through this. And the third section within the fetal medical conditions is chromosomal and genetic disorders. So trisomy 13 is one of them, trisomy 18, severe cases of Down syndrome, or there's lots of other genetic disorders, such as our baby had Ellis van Creveld, a very severe form of that. I'll talk about that at the end. So that's the sort of fetal medical conditions as to why somebody might choose a termination for medical reasons. There's also maternal health risks. So preeclampsia or eclampsia, severe pregnancy complications causing dangerously high blood pressure. The next one is HELLP syndrome, which is liver and blood clotting disorder. It's life-threatening for the pregnant person. The next one is placental abruption, where the placenta detaches from the uterus, cutting off oxygen. Cancer or other serious medical conditions that make continuing pregnancy life-threatening. And then the last one is heart conditions that can make childbirth unsafe. And then the third reason why somebody might choose a termination for medical reasons is mental health considerations. So in some cases, mental health conditions can be severe enough to justify termination for medical reasons, particularly if continuing the pregnancy would result in serious psychological harm, such as PTSD or suicidal ideation. So those are some of the reasons why people might choose a termination for medical reasons. Section number 3 is termination for medical reasons the same as elective abortion? So here are some similarities. They both involve ending a pregnancy, and the procedure can be the same if you have the D&E or induction. And now some of the differences. Termination for medical reasons is almost always a wanted pregnancy. This is somebody who has wanted to get pregnant, who has planned their names, maybe thought about a nursery, maybe done a baby shower. You know, they're really excited about this baby and then they realise something is happening and they might have to terminate the pregnancy. So that's one of the main differences, where somebody receives a diagnosis or some devastating news and they have to be sort of faced with this really difficult decision. The decision is often made out of necessity rather than choice. And I don't want to sort of say that elective abortion is always a choice, because I know sometimes it feels like that is the only option that you have. So I'm literally reading from ChatGPT. I'm doing my best here. I do understand that sometimes people are pregnant and they want the pregnancy, but they still choose an elective abortion because it's not the right time, but maybe next year they'll try again or whatever it is. And also it might feel like you have to make a decision out of necessity and it isn't necessarily a choice. Maybe if you fall pregnant by accident, you don't want to have an abortion, but you feel like it's the necessary thing to do. This is more like from a medical standpoint. You know, if you're pregnant when you don't want to be pregnant, you probably could continue that pregnancy and be healthy, have a healthy baby. This is more like the medical side of things, where there really is something medically wrong with the pregnant person or the baby. Parents going through termination for medical reasons often experience stigma and isolation because people assume all abortions are the same, which is so true. If you've had a termination for medical reasons, I always just say I've had an abortion. I just say it outright. I say what it is. But I do recognise that there is a difference there between an abortion and a termination for medical reasons. They are two separate things. And by the way, not one of these is worse or better or easier or harder than the other one. They are just slightly different. So I'm really trying my hardest not to, you know, say that abortion is easy and termination for medical reasons is really hard, or that abortion is a choice, termination for medical reasons is a necessity. I understand the lines are blurred and it's a really tough topic to talk about, so I am trying my best. Please don't come at me. But yeah, I do feel like abortion in general is, you know, there's a big stigma around it. People often feel alone and like they're the only ones going through it. But I feel like especially a termination for medical reasons, it's even less talked about. It's even less, I guess it is less common, but it's just less talked about and people just don't really talk about this topic, which is hence why I'm doing this video. And then the last one that is linked here about the key differences is that legal barriers exist in some countries, such as Ireland and certain US states, where people have to travel abroad to access care. So the fourth section of this video, I want to talk about what are the risks of termination for medical reasons. So medical risks are physical risks such as infection, heavy bleeding, uterine damage, retained fetal tissue, so you might require a second procedure. And then in terms of future pregnancy risks, it says that most people can conceive again with no complications. Rarely, scarring from surgery can impact future pregnancies, and emotional trauma may affect future pregnancies. So fear and anxiety, which is 100% true. I believe that. And then the other side of the risks of termination for medical reasons is the emotional and psychological risks. So grief and trauma, many people experience deep grief, guilt and emotional turmoil over having to make this decision. I think especially because some of these pregnancies are being terminated later on in pregnancy, you know, we're finding out that there's issues from 20 weeks. It can feel like a very big decision and lots of guilt and shame and yeah, a lot of tough emotions around terminations for medical reasons. The next one is feeling isolated. So some people feel disconnected from support groups that discuss miscarriage or infant loss because termination for medical reasons is misunderstood. So I think oftentimes, you know, people talk about miscarriage and how if somebody loses a baby without wanting to or without meaning to or by accident or whatever happens, that can feel very different to having a termination for medical reasons because that baby was also wanted. And yes, technically we make a decision to end a pregnancy, but it's not a decision that anybody wants to make. So I feel like, you know, miscarriage, abortion and termination for medical reasons, they're all infant loss, but they're all kind of seen differently. So the next one is stigma and judgment. So society often lumps termination for medical reasons with elective abortions, making it harder to find support. So like I said, termination for medical reasons and abortion are two separate things. They're often lumped together as, you know, ending a pregnancy, but oftentimes the reason behind ending the pregnancy is very, very different. And then the next one is PTSD or depression. So people having flashbacks, anxiety and depression are very, very common with people choosing to have a termination for medical reasons. And I keep saying choosing to have a termination for medical reasons. I remember when we had it, it didn't feel like a choice. It didn't feel like I had a choice. Like, yes, I signed a paper and yes, I said yes, but it was that or like a worse outcome. Like it's the lesser of two evils. So, you know, I'm saying choosing to have a termination for medical reasons. I didn't feel like I had a choice. I don't feel like I chose that. I would never have chosen that for myself. So it's, the wording around this is really hard. Section number 5 is support and healing after termination for medical reasons. So TFMR, termination for medical reasons, specific support groups are, for example, ARC, which is antenatal results and choices, and there's another one called ending a wanted pregnancy. So there are some support groups there that you can find. I would love to grow this community more and start providing support groups for different people. So support groups for abortion, support groups for miscarriage, support groups for IVF, support groups for TFMR, support groups for whatever else it's going to be, and have groups of people that can come together around specific topics, and also be able to go into different groups, because I've had 2 miscarriages, a missed miscarriage and a termination for medical reasons, which I always just call a late term abortion, or just abortion in general, just because it's quicker and easier. But I think I need to be more specific about what I've been through to be able to connect with people on a deeper level versus, I don't know. So another thing to talk about with support and healing from termination for medical reasons is speaking with others who understand. So sharing your experience can help reduce stigma, which is why I'm here today talking about this, and I'm going to share my story as well. Memorialising your baby. So many parents choose to name their baby, hold a memorial, or create keepsakes. I have a tattoo on my wrist here which is to do with my abortion. People often get tattoos, maybe they get jewellery, maybe they have photographs or scan things, or a little shrine or something in their home. You know, these little things that you can have to help you stay connected with the babies that you lose. Therapy and counselling, so working with a therapist who specialises in grief and loss can be super helpful. I have not found that helpful for myself. I found other things helpful, but it's worth trying. And then pregnancy after loss support. So if you're considering another pregnancy, support groups exist for navigating the complex emotions. So a lot of people, you know, if they either have a miscarriage, abortion, stillbirth, whatever it is, TFMR, might then go on to have a pregnancy and have a lot of struggles mentally with, you know, preparing the body for pregnancy again, feeling baby kicking again, thinking about names again, being scared to try again. So there are also support groups and people available that you can talk to about these things. So I'm now going to share my story. I'm going to try and keep it brief. I've already been filming for 18 minutes at this point, so I don't want this video to be 3 hours long. So it's given me some bullet points here to run through. So the diagnosis you received and how you learned something was wrong. So at 5.5 months, well, even before that, at 5 months, I was quite small. Like I hadn't really popped. If I wore a t-shirt or a jumper, people could typically not know I was pregnant. It was only if I sort of held the bump, people could see it, or if I wore tight clothing. So then at 5.5 months, we're at 22 weeks, we went for the 20-week scan, and I remember she was just very silent, didn't really say anything. She kept scanning. It was quite a long scan, and we were just like, is everything okay? She'd be like, just 1 minute, please. Just 1 minute, please. I'll talk to you in a bit. I'll talk to you afterwards. So we just sort of looked at each other like, what is going on? This is not normal. Sat down, and she said to us, there's loads of issues and abnormalities with the baby. So we didn't really know what that meant. I think I just was in shock and I cried and didn't really know what was going on. So she said, okay, you're going to be off work from now on and we're going to book you in for loads of appointments. So I had about a month of appointments where I would go and see doctors, heart specialists, baby specialists, and every time we got sort of different news. And I remember one of the scans that we did, me and my husband were sat in the room and we counted 6 fingers on each hand of the baby. And we were doing this scan and I was like, 1, 2, 3, 4, 5, 6. Okay, 1 minute. 1, 2, 3, 4, 5, 6. And I remember just thinking like, this is a joke. I feel like I'm dreaming. I feel like someone's pranking me. It just didn't feel real at all. And I looked at my husband being like, what's going on? Are you counting 6 fingers? Yeah, I am as well. And we went to scans where they would test the heart of the baby. So they were looking at his heart, his lungs, his bones. Basically, long story short, so it says the moment you realised that TFMR was the only option and how it felt to make that decision, we were basically told that the baby had Ellis Van Creveld. So this is a very rare form of dwarfism, and we were basically told that the options were have a termination for medical reasons, and I could have done that up until about 38 weeks, I think. So I could have had, you know, a full pregnancy and a full birth, but it would have obviously terminated before that. But I thought rather than growing this baby even longer and getting more connected to the baby and seeing a full-size baby, we decided to terminate pretty soon afterwards. So we took about 4 weeks between the first initial consultation when we found out something was wrong to then having the abortion. But basically he had heart problems, lung problems, bone problems, I think there was something wrong with his teeth as well, those joints. That was it, sorry, I was saying. So the options were to have the abortion either now or later on in the pregnancy. If we didn't choose the termination and we gave birth, I think most babies are stillborn. If the baby was born alive, most babies die within the first week or two. If they survive that, most babies then have to, like, he would have needed lots of heart surgeries, lung operations, obviously finger removal, like loads of operations, and probably would have died then. And even if they survived that, they would have had so many medical issues and spent the first couple of years of life in hospital, struggling, fighting, and maybe not even making it out alive. So it just sounded like to us, like, it's going to make it sound like an easy decision. It wasn't at all, but it's kind of like either we end the pregnancy now and the baby doesn't suffer and we suffer less, or we give birth to a baby and he might not even survive. He's going to be in pain, he's going to have all these operations, all this worry, we're going to be sat in hospital trying to figure out what to do, and then probably lose him at some point anyway. The rates of this are quite low, and we got asked a lot if we were related, because it's quite an inbred syndrome apparently, where there's, you know, in places where there's a lot of inbreeding, this particular thing is common. So they asked if we knew each other, if we were related. We were like, not at all. He's French, I'm English. We met in Australia. Like, we don't know each other. We're not from the same place. So that was also interesting, being asked those sort of questions. And I think there's about 150 people in the world who've ever been born with Ellis Van Creveld or something. I mean, the information might have changed by now. This was in 2017, so it might have all, you know, changed. It was almost 8 years ago. But we were sort of told that the chances of survival are not great, and because also he had a very severe form of Ellis Van Creveld, it wasn't just the light version. I don't even know if you're allowed to say that, but it wasn't just, you know, one or two little things. It wasn't just an extra finger. It was like problems with the heart and the lungs and everything else. I've actually found a guy on Instagram who's got Ellis Van Creveld, and I find it really triggering, but also really weird to see him living his life, because I almost think like that could have been my son. He could have been okay, but then from what the information that we had at the time and what we were told was basically termination is the best decision for you and the baby, so that you're not in pain, but mostly so the baby isn't in pain and doesn't die in pain and experience pain. So that is a lot. So yeah, the moment we realised basically was when we got, you know, when we went to all these appointments and all the doctors were like, this is really serious, this is really serious. And they had a big board meeting and basically told us the options. When I said, you know, throughout this video, when people choose to have a TFMR, yes, I signed the papers. Yes, I said, okay, we'll do a termination. I didn't choose that. I would never have chosen that for myself. That was not a choice that I wanted to make. That was not a choice that I enjoyed making. I hated the whole thing, and it was traumatic. It was awful. I was depressed for a while, suicidal for a while, did not enjoy life, and it's really shit to go through, and it's not spoken about enough, and people feel like they're alone. People feel like they've made the wrong decision, like it was a, you know, it's just a lot. It is a lot. Okay, so the next one is what the process was like for you. Example, medical procedure, the emotional journey. So we did the induction, so I gave birth to him. I'm going to run through this quickly because I don't get too emotional. Basically, we had to go in for loads of testing, like I said, and I think we'd booked in for the Friday, but then I think on the Monday they said to us, oh, we've got somebody cancelled on Wednesday, so you can come in earlier. So we ended up going in on the Wednesday instead. Went in Tuesday night. I wasn't allowed to eat the night before. I had to wash myself in that brown stuff, iodine or something, to like clean my body with that, which was awful, my hair and things. I honestly think I've blocked a lot of this out. I don't think I slept that night just because I was terrified and I was crying and it was just awful. Ended up having an epidural, so I couldn't feel my legs, and then from that point they injected in and stopped his heartbeat. I was crying. I actually threw up because it was just awful. I think also maybe in the morning they inserted things into the vagina to induce labour, and then also when I was on the table, and then I started getting, I'm having a brain fart. I can't think of the word when you get contraction. It started getting contractions, and she said to me, at some point you'll feel the need to push, and I was like, okay. And there was one time where I felt the need to push, but I didn't say anything. And the next I was like, okay, I need to push, and then I pushed out a dead baby basically. And I was 6.5 months pregnant, and you know when you watch TV and films and things and the baby always cries and that's when you know the baby's okay? Like, as I was pushing, I was just sobbing. I didn't even push. I think I had to basically pull him out of me because I just like was a complete mess. And then we held him for about an hour or so until he went cold. And I'm getting emotional because this is a lot to talk about, so we're going to move on. Emotional journey was shit, was awful. depressed, suicidal, not loving life for a little while. How you coped afterwards, what helped, what didn't help. What helped was I started a blog. I needed to do something so that I could focus my mind on something, so I started a blog, rosieandre.com, and if I had a good day, I was living in the south of France, I would take myself for a day trip somewhere, take photographs, try and have a nice day, and then I'd go back, and then throughout the week I'd write a blog post about that place. I've now since then deleted all of the blog posts because they were awful, the photos were shite, but it kept me going and it sort of gave me a purpose and a reason to get out of the house, honestly, because there was a little while where I didn't go out of the house for months because I just felt like I wasn't worthy, or I didn't have a reason to leave the house. I didn't have a reason to live, honestly, at that point. So what didn't help? I think being left on my own, because my husband went back to work after a couple of weeks. My parents and my family lived in England. My friends lived about half an hour drive away, so I was on my own a lot, and I think just being stuck in an apartment on my own, going to therapy in the same hospital on the same floor as where I had the abortion, with a French psychologist, when French was not my first language, and honestly I can stumble through French. I wouldn't say I'm bilingual, but trying to go to those, I would come out of those sessions so triggered, so traumatized, so bad, honestly, so bad. So I don't recommend going back to therapy in the same place where you had the abortion or the termination. I'd recommend trying to find someone online, someone somewhere else. I also think moving to Miami helped, and I know that's completely unrealistic for a lot of people, but we had the chance with Jeremy's work to move to the US, so we did that, and I feel like that was a blank slate, start again, forget all that shit in the past and start a new life without people feeling sorry for me or without people knowing my story. I could start again as Rosie, who's from England, who's lived in France for a couple of years, versus Rosie who just lost a baby at 6 months pregnant. So that helped, but obviously I know that's not realistic for a lot of people. The stigma you faced, if any, and how you handle people's misconceptions. I don't think in person I faced much stigma and people's misconceptions. When I've shared about this on my personal YouTube channel, you can just search Rosie Andre, and there's I think about 4 or 5 hours of me and my husband talking about our whole journey. I also did a lot of videos on embryo freezing, which is also on my channel, so you can go ahead and watch those. And I would say the main stigma, or the main thing I've faced, is people commenting calling me a murderer, which is obviously not ideal, not fun. It's tough because, you know, abortion in general is looked down upon. People are called murderers, and, you know, just to give it up for adoption, or just do this or just do that. But to be called a murderer for a pregnancy that I wanted, for a baby that I wanted, that I'd felt kicking, I'd given him a name, I loved him, and I wanted him deeply, and the only reason I did the termination was because all the medical professionals around me were saying you need to have a termination so that he is not in pain, and then to be called a murderer for that is obviously not nice. And then advice for others going through termination for medical reasons, including what you wish you had known. Oh boy. I don't know that I have advice, because I don't think I handled it well at all. And I think everybody's situation and circumstance and experience is going to be different. I was in France when I'm English, and French isn't my first language, so I struggled a lot with the medical things. I didn't know I would be sick on the table. I didn't know what an epidural would feel like. I didn't know what giving birth would feel like, or contractions. I didn't know that he would be purple. He had purple skin. I'm never ever going to share a photograph of him, I don't think. But it was only the ends of his fingers and the ends of his toes that were white, but the rest of him was purple, which I really wasn't, like a dark purple. Wasn't expecting that, didn't know that, no one told me that. So we saw him, we were like, whoa, like quite shocked. What else do I wish people knew? Advice. No, I guess advice for other people going through it. I think find a good therapist or someone to talk to, because I never did that. And I'm now sort of put off it a little bit, whereas I wish I'd found someone as I was going through it all. And then I think also is find someone to do healing practices with, whatever that is. For me, honestly, yoga, meditation, sound baths really helped me a lot in my journey. So maybe I'll leave some resources. I interviewed somebody recently called Jen. She's going to be on the podcast on YouTube coming soon. She knows a lot about trauma-informed care. She knows a lot about yoga, meditation, mindfulness, Pilates, that kind of thing, breath work as well. I'd recommend her. Yeah, I think find people who've been through something similar that always comes up as recommendation, but it's hard because when I went through this afterwards, I did not give a shit if somebody else had a miscarriage. I didn't give a shit if somebody else had an abortion. I didn't give a shit if anybody else had a stillbirth or a termination for medical reasons. I was so deep in my own stuff that I just didn't care about anyone else. But then I've also heard of people who go through something like this and they find a support group of people who've also been through something similar, and they find it really healing. So I would like to provide that service for other people I just know that when I went through it, I didn't give a shit. Like, I really couldn't care less about anybody else's story. I was so focused on my own stuff and what was going on. I think try and find something that could help calm your nervous system is maybe what it is. Whether it's yoga, meditation, breath work, sound baths. Find something that really calms you down and allows you to sleep. Because I remember afterwards closing my eyes, I would always see his face and I couldn't sleep for ages as well. So, final thoughts and call to action. It says here, if you've been through termination for medical reasons, know that you are not alone. I promise you're not alone. I've been there. I'll leave my email below. I'll leave my Instagram below. Whatever, please contact me. You are not alone. I'm here for you. I support you. Your grief is valid also. So valid. You wanted that baby. You loved that baby. And yeah, it's, like I said, it's not a decision that anybody wants to make, and I'm so sorry if you're going through termination for medical reasons. If you're going through it, I'm so sorry, because it is not fun, and I know that you don't want to be doing this either. So that's it for this video. Thank you so much for watching. If you have any questions, please do let me know in the comment section down below. I apologise at the beginning, I was completely butchering those words. I'm not a medical professional. I'm just somebody who has experienced pregnancy loss, and I want to talk about pregnancy and infant loss. So I apologise for butchering the words, but I hope you found this video informative or supportive, or I hope you gained something from it. If you did, please consider subscribing. You can like this video and share it with anybody else you might think might also like this video. If you would like to share your story, feel free to leave it in the comment section down below, but I'm also going to leave a form, a Google form, where you can write your own story and you can be featured on the website. I really want to gather as many stories of infant loss as possible so that they have a really good library of stories, so someone can go onto the website and find someone they can relate to, someone who's been through something similar. So if you feel like that is you, I will leave the link below. I will also leave the link down below so you can sign up for group counselling sessions, or also some retreats. I'm looking at hopefully doing, I would love to do 2 or 3 retreats this year. I'm not sure if that's going to happen or if it'll be next year, but you can sign up for the waiting list and sort of show some interest and fill out a little questionnaire about what you would want in a retreat. And I will leave some resources down below as well, some links to websites and places like that where you can find some more information. If you are going through a termination for medical reasons, I am honestly so sorry. I wouldn't wish it on anyone, and I'm sending you all of my love. And yeah, if you need me, I'm here for you. Send me a message on Instagram or email me, and I'm sending you so much love and healing energy. Bye guys.